Welcome to the Explainer. So, today we're diving into one of the absolute most critical shifts happening in modern medicine right now. Think about it. Getting rapid, incredibly reliable diagnostic answers exactly when and where you actually need them. In emergency rooms, clinics, hospitals, time is literally the most precious resource, right? Waiting hours for a lab result, that can mean the difference between a fast recovery and a critical complication. Okay, let's jump right in and explore how a company called Nano-Tech Corporation is engineering the hardware and test kits to bring the laboratory directly to the patient's bedside. Now, to really wrap our heads around what we're looking at today, we need to ground ourselves in a concept called point-of-care testing, or POCT for short. Listen, this isn't about taking a blood draw, sending it down to some basement lab, and just waiting. No, this is about performing in vitro immunodiagnostic testing right there, right next to the patient. So the crucial point here is that by completely cutting out the transit and processing time of a centralized lab, healthcare providers can make rapid clinical decisions right on the spot. It is truly a revolutionary way to practice medicine. Here is our roadmap for today. 1. About Nano Ditech Corporation. 2. The Fluoro-Checker TRF system. 3. Nano-Checker 710 reader. 4. Rapid COVID-19 testing. And 5. Advanced cardiac point of care. Section 1. About Nano Ditech Corporation, founded in 2002. Nano Ditech operates right out of Cranberry, New Jersey, where they've actually been headquartered since 2002. They are intensely focused on developing and manufacturing high-quality immunodiagnostic products specifically to serve medical professionals, labs, and hospitals worldwide. Oh, and for those of you listening in the US who might be looking to bring this tech to your facility, their authorized channel partner is Mr. Ajay Virmani. I'll make sure to share his exact contact details for any demo queries a bit later on, so definitely keep an ear out for that. So while they serve a really wide array of critical medical markets, we're talking everything from drugs of abuse and infectious diseases to inflammatory and cardiovascular issues, their real technological leap, the thing that really put them on the map, was becoming a pioneer in high-sensitive, europium-based time-resolved fluorescence, or TRF. Yeah, I know it's a bit of a mouthful, right? But essentially, this is a next-generation diagnostic technology that allows for incredibly precise measurements of markers in the blood. This technology is literally the engine that drives their absolute top-tier equipment. Section 2, the Fluoro-Checker TRF system, a europium-based system. All right, check this out. This is the Fluoro-Checker TRF reader. When you are designing hardware for a super fast-paced emergency room, usability is honestly just as important as accuracy. And you can see that large 10-inch color LCD touchscreen just dominating the interface. It runs on a rock-solid Linux operating system, and get this. Despite being an absolute powerhouse for lateral flow image analysis, the whole thing only weighs 2 kilograms. It's compact, it's totally portable, and it's built to just seamlessly integrate right into hospital information systems. So, what does this machine actually do for a doctor on the floor? Well, it provides purely quantitative testing solutions. And most importantly, and this is a massive, massive game changer for busy labs, it requires absolutely zero calibration or maintenance. None. Because it relies on that highly sensitive europium TRF image analysis we just talked about, it acts as an incredibly reliable workhorse. You literally turn it on, insert the test, and you get quick, accurate, quantitative data. It is perfectly positioned as the primary screening tool for ERs, hospitals, and physician offices where, let's face it, time and accuracy are totally non-negotiable. Moving on to Section 3, Nano-Checker 710 reader, utilizing colloidal gold tech. And I think this brilliantly illustrates the whole Nano Ditech ecosystem. On the left, you have the Fluoro-Checker we just discussed. On the right, the Nano-Checker 710. Physically, they share a very similar, robust form factor. They both feature that great 10-inch touchscreen, the internal and external printer options, the barcode scanners. They are clearly siblings, right? But underneath the hood, they are running on entirely different core testing technologies, specifically tailored for very different clinical needs. Let's break down exactly what that difference is. The Fluoro-Checker uses that europium-based, time-resolved fluorescence we talked about, and it strictly provides quantitative results, meaning exact numerical values of a marker. The Nano-Checker 710, on the other hand, utilizes colloidal gold immunoassay technology. It works by capturing and analyzing the optical densities of the test line right there on a cassette. And because of this, the 710 can provide both quantitative and qualitative results, offering a highly cost-effective and super flexible solution for multi-analysis platforms. Section 4, Rapid COVID-19 Testing, featuring antigen and antibody kits. Now, infectious disease management requires speed and it requires massive scale. Nano Ditech engineered a dual approach to the SARS-CoV-2 virus, the Nano-Check COVID-19 antigen test and the IgG and IgM antibody test. What makes these specific cassettes so incredibly valuable is that they require absolutely no reader equipment. None at all. They are completely self-contained lateral flow tests that can be administered literally anywhere, from a local clinic to a totally remote testing site. As we all know, the most vital metric during an outbreak is speed. And 10 to 15 minutes, that is all it takes. The antigen test yields a rapid result in 15 minutes using a nasopharyngeal swab, while the antibody test, which just uses a tiny sample of whole blood, plasma, or serum, delivers results in just 10 minutes. 10 minutes! But hey, speed means absolutely nothing without accuracy, right? And this builds a super compelling clinical case. The antigen test boasts a stunning 100% specificity and over 92% sensitivity. The antibody test is incredibly precise as well, with nearly 98% sensitivity and 98% specificity. But here is the kicker. Crucially, both of these tests completely bypass the need for complex cold chain logistics. Why? Because they can be safely stored right at room temperature, anywhere from 2 to 30 degrees Celsius. In the world of global healthcare logistics, that is a massive, massive advantage. Section 5. Advanced Cardiac Point of Care, focusing on multiplex diagnostics. Okay, when a patient arrives at an emergency department with chest pain, every single minute counts. I mean, the clock is ticking loudly. Nanotech has engineered a sheer variety of cardiovascular tests specifically for their readers to tackle this. They cover everything from single critical markers to these complex multiplex panels that can test multiple cardiac indicators simultaneously, all on a single cassette. Let's look at exactly what markers they are targeting here. You have CTNI, which is cardiac troponin in I. That's a primary indicator for a heart attack. You have D-dimer, a totally vital marker for ruling out deep vein thrombosis and pulmonary embolisms, and NT-proBNP for heart failure. But what's truly remarkable to me are the AMI 3-in-1 and 4-in-1 multiplex tests. Get this, these allow a physician to run a comprehensive cardiac panel using just an 80 microliter sample of blood, and they get quantitative results back in just 15 minutes. This empowers doctors to rapidly triage and treat acute myocardial infarctions right there on the spot. It's a lifesaver. And you know, that really brings us back to the human element behind all this hardware and clinical data. This quote perfectly summarizes Nano Ditech's core mission. They state they want to improve the quality of patients' healthcare by providing confidence to those making clinical decisions using our products. At the end of the day, all the European fluorescence and colloidal gold technologies we've talked about, they all serve one single purpose: giving doctors the unshakable confidence to make the right call right now. As we wrap up this explainer, I want to leave you with a thought. We are quite literally watching these centralized laboratory get packed down into a 2-kilogram, 10-inch touchscreen device that sits right next to the patient. So how will rapid, decentralized diagnostics continue to reshape the future of emergency medicine? It's a fascinating question, and as technology like we've seen today continues to evolve, the answers will inevitably save more lives. Oh, and as promised earlier, if you are looking to bring these answers to your facility, the authorized channel partner for Nano Ditech USA is Mr. Ajay Vermani. For any demo-related queries, definitely reach out. You can contact him directly on his mobile at 987-3011663. Again, that's 987-3011663. Thank you so much for joining me today, and keep questioning the science that shapes our world.